All right. Well, thank you guys so much for coming on in. My name is Jeff Comp. I'm one of the associate program directors for the, well, thank you. Yeah, I'll pause for effect. I'm one of the associate program directors here in Phoenix at Maricopa, or Copa, if you guys have been around here for a little bit longer. I have the incredible honor of essentially being show host for what we have as an incredible panel of wilderness medicine educators and experts from across the country. And it's pretty interesting. We know each other, we've worked with each other, and we've developed different teaching opportunities and protocols. And what we want to do today is share with you how to start to incorporate or how to strengthen and solidify your didactic education experience within your emergency medicine residency, or if you're interested in just kind of dipping your toes in the water of what are some ways to teach this outside of, a blue PowerPoint with yellow text, right? So, the interesting thing about this type of education is it's really translatable, but needs to have a good focus, right? So the first thing as you're developing any kind of experience, you need to start with what you want your learner to take away first, right? Obviously, we all want to just run around outside, right? That's kind of why we're all sitting here. That's why I am standing up here. But if you start sort of, using the platitude, start with why, you really have a good educational development. So we think about kind of the big things, right? The cool things within wilderness medicine, dive medicine, high altitude. Here, SAEM here is in May. It's like this pretty burly move. It's usually pretty sub-apocalyptically hot here. So that's something that we focus on here. But truly, wilderness and environmental medicine can be seen everywhere in the country. And what you really need to start doing, and what we're going to talk with our panel here about, is what are some of the things that you can be teaching and how can you teach it to effectively, translate the actual content, but also the mindset of wilderness medicine. Improvisation, understanding what you can do with different materials, thinking outside of the box, and also conditions that we see typically in the backcountry, but might show up in your ED. And that's the thing that I really spend a lot of time talking with my residents about is, what are you gonna do? Here they train in Phoenix, but if they're moving up to Michigan, what are you gonna do with a cold patient? How are you gonna deal with drowning? Hyperthermia, hypothermia. All of these are wilderness medicine, but we see them all the time. So we talk about that bridge. What will that look like? And that's another key point that I want you guys to be thinking about. For those of you, I really hate saying it like this, but what I will say is sometimes it takes a little bit of some discussion. I'm not going to use the word convincing, but sometimes it's convincing if you're starting to develop this kind of content in a place that hasn't had it before. So using those thoughts and being able to talk about why we're teaching it, what we're teaching, is a great strategy to help start to advocate for that kind of inclusion into your residency or med student education. And there are many different ways of doing this. So I'm gonna just sort of, actually these guys don't know it. I'm just gonna put them on the spot. I asked some of them to give me some slides. Some people have a couple of slides showing some of the activities they do. I'm gonna give you guys a couple minutes with your slides, and then I'm gonna just call you guys out to sort of say, what are some things that you do? And then I'll pepper you guys with some questions, and if there are questions from the audience, we'll ask too. So to start off, this is us. We do a lot of different experiences. We have a wilderness medicine day. We have a drowning day where we take them out to the lake during intern orientation. We work on submersion injuries. Unfortunately, in Phoenix, drowning is a significant public health issue. So early on, we have a lot of conversations about management, questions for EMS, those kinds of things. I'm at a point in my life where I have now 2 snake guys. So we take them up to one of our sort of snake zoos. This incredible experience and opportunity to go through envenomations, management, treatment, all that kind of stuff. This is everything from MedWar, so medical wilderness adventure racing, all the way to different commercial courses that can be taught. A big one here is simulation of musculoskeletal or trauma injuries. Here down on the bottom right, this is one thing I'm particularly proud of. One of my ultrasound fellows made an arterial bleed sim by attaching a Foley catheter to tubing and a motor from a car windshield wiper fluid, and I could sit and push a button and cause an arterial bleed. So when we're talking about March, so massive hemorrhage, airway, trying to figure out how to truly have someone understand and address that in this simulated patient there is an arterial bleed and tourniqueting is necessary, it's pretty dramatic. And then the other thing that I always have to say, it gives me the willies. So up here, this is all simulated. No one's wearing gloves, and that always makes me feel weird, but always, BSI scene safety. So then now, and then this is the last one that I have. Part of what we do and what I do, and I'm sure what everyone up here does, is works on trying to educate the students to then be able to educate others. So I'm very fortunate to have a significant amount of residents and medical students who are interested in the topics, but also interested in teaching and educating the next level. So here are a couple of my senior residents that are giving a lecture on C-spine management. Here's another one that's helping out with placing a tourniquet and instructing on how to actually do it. And then another one down here doing an airway lab. So I'm going to head it on over to Walt Schrading. So what I'm going to do is I'm going to just give you guys the microphone. Actually, you have one. Quick introduction, where you're at, and a little bit about what you'd like to talk about.
Sure. Good morning, everyone. Walt Schrading. I'm at UAB. I guess I get to lead this off. And so some of the teaching activities that I developed when I moved to UAB about 10 years ago, and got the faculty position that I'm at now by basically saying, I want to start a wilderness medicine program. We talked about a division of wilderness medicine. My chair said, you can't have a division, but you can have an office. And I said, okay, well, I'll be the Office of Wilderness Medicine. So I kind of self-created my own title. I'm the director of the Office of Wilderness Medicine.
That's fantastic. This language, right?
I am the Office of Wilderness Medicine. So it's kind of cool. There's some things you can do in academics. Just give yourself a title, give yourself an office, and, boom, you got an Office of Wilderness Medicine. So that was cool. But I've focused my training and teaching activities both for residents and students. When I got to UAB, I looked at the opportunity for starting a medical student elective. It turns out that UAB has what's called special topics courses. These are courses that run between semesters. All the medical students are required to take, I think, 4 of them during their 4-year career. And so they're basically little time frames of 1-week periods of time where you can create a special topics course. So my first activity was to create a wilderness medicine special topics course. It's a 1-week or 5-day course that I put on for 3rd and 4th year medical students. At times we have built in a WLS MP course into that as well, taking a pre-made course, canned course, so to speak, and brought that in. And then the students, as well as other persons who come to do this course, I can bring in nurses and paramedics and other physicians to take the course as well, along with my students during their special activities. I've been able to leverage, I'm the sort of only one who teaches wilderness medicine per se, but I've kind of been able to leverage the opportunities that I have with my colleagues. My toxicologists come and talk about plant toxicology and snake envenomation. The course location is at a nature center, and the snake expert, the naturalist, then brings the snakes out and shows the students, so that's kind of good hands-on activity. I bring out my gamma bag to kind of teach my altitude stuff, and I let my hyperbarics folks talk about the altitude illnesses. So I bring in a lot of the faculty that are affiliated and associated with topics in environmental medicine. So this would be dive medicine, hyperbarics, toxicology, that sort of thing. And then the other piece is that I focused on, and part of what I got the idea here was, I think it was at the ACEP interest group about 7, 8 years ago, there was a talk about we had we didn't have a curriculum for residency track education. So I was one of the authors for a residency track education curriculum that I published in Environmental Wilderness Medicine, and then put that into use in starting a residency track at UAB. I do kind of a little mini adventure race with my students during their course as well. They like to, I teach them land navigation, and then they run around in the woods and find all these questions and answer the questions. Usually there's a scenario attached with it as well. And then the other piece that's been able to involve students, and I just got out of the plenary session, and one of our students who was at our course yesterday was speaking at a plenary session. A third-year medical student gave a plenary session on, what was his topic? I think it was, pharmacy deserts. Anyway, the opportunity for a third or fourth year medical student to get involved in a research project is really a driver of interest, both to emergency medicine as well as to wilderness medicine activities. And I've been fortunate enough to have students come to my office or email and say, hey, do you have a research project you're interested in? And I've had the opportunity to get a couple of really nice student-run research projects looking at devices that might be useful in austere environments, things like handheld EKG devices like the KardioMobile or a pulse oximeter. I ended up getting my pulse oximeter study published during COVID, after the research had already been done, when everybody was interested in pulse oximeters, so that was a kind of cool thing. But keep in mind the opportunities that you can do unfunded medical student research pretty easily, as long as you know your way around, setting up a project, getting it into the IRB, and then getting the student involved. Usually they'll collect all the data, and then you have a publishable piece of information that the student can put on their CV and use for their future endeavors, whether it be residency application or faculty. So those are just some of the activities, Jeff.
That's great. Thank you so much. And I think a couple key pieces to think about are understanding what your associated medical school or what your medical school requirements are, right? To be able to say, here's a need, here's something that you actually could add as a function, as an educational component, and leveraging that. I also love the idea of getting more people involved in research. Sometimes, research, I mean, for me, we're all wilderness medicine here. There may be some people interested in bench research, but probably not a lot of us. I'd rather eat a whole bus tire than do a bunch of biochem bench research. But there are a lot of really interesting questions that we can ask every day when it comes to medical education, when it comes to some of these wilderness questions. The things that I think about, like, what are some of the technical constraints of ultrasound at high altitude, in cold weather? These kinds of things are interesting questions to ask, and with good mentorship, like Walt was talking about, it's really, really a great way to get multiple levels of people learning and getting going to the next step. We're gonna have over to Jay.
All right. I usually don't use a mic because I speak really loud. So I'm probably a little different from a lot of the other speakers here. So I'm a department chair. And honestly, my secondary board is addiction medicine. So how does that fit into this at all? So it's always, to me, was when I was kind of fading into leadership, I thought, my wilderness medicine time is kind of over. But it's always been, honestly, learner-driven. So interest from residents, interest from students. Carried on. So the way that I parlayed this, along with all these other responsibilities, is specific wilderness education days. But having those days gives opportunity for three things. One is skills development, for learners. Two is, well, make it four things. Two is tying in some of the EM model of care. So we talk about hypothermia management, foreign body management, vector sting management. You can incorporate that into a day. But this also then turns into an opportunity to train your residents as teachers. Because one thing we know for anyone, who here is a resident? Just by show of hands. How many of you supervise interns, medical students, all that stuff? Right, all of you. How many of you have been formally educated on educating students, interns, and older attendings? None, right? So it gives an opportunity for that. And the fourth thing, and this might come kind of interestingly, it gives an opportunity for faculty development, which is where an area of interest of mine lies. Because whereas you take someone who may have done an EM residency in an urban setting, who never spent a lot of time outdoors or in resource-limited environments, but then train them to be able to teach and provide that education to others. So that actually gives a really interesting opportunity to do that. So for us, the way we can do that, we're suburban New York City, so we have a lot of water around us, so we might actually take elements of things that we see. So for instance, 2 years ago, to your point, we did a shark bite simulation. We actually had a resident develop a bleeding arm out of a pool noodle and a pump, half an arm. And wouldn't you know that last summer we had 3 shark bites in our department. Nothing too terrible, we're not talking Jaws here. But, so it allows you to provide also local specific education in things that you might need. So we do this by having specific wilderness days, largely in the summer during that intro month. We have done winter ones, but we usually get more balking from the residents of, why do I have to go outside when it's cold? I don't like to hike, so we don't do those as much. Last time we had one of the building snow caves, it broke down to a snowball fight, which is okay, because then that's your wellness element. But so, I guess the purpose of, what I'm talking about is, regardless of what your role or position is, there's always an opportunity to incorporate education in a different way. So just as we think about improvisation in wilderness medicine, you think about educating differently as well and hit a whole lot of different touch points.
That is such a great point, right? Thinking about how you can teach it as well as the interesting ideas of what topics we are going to teach. Ooh. All right.
So I'm Stan Chardoff. I'm from UConn School of Medicine, Emergency Medicine Residency. These first 2 slides that I just stuck in there were just a way, this is how I presented it to our department. When I initially came, I had an interest in wilderness and austere medicine, and we decided to first initially introduce the curriculum in as a wilderness track. But then we get to the nice slides here. So
I'm just skipping all the words.
Yeah, you don't need to read. But I think one of the unique part of our program, we started as a wilderness track and we kind of infiltrated into the rest of the residency, different programs that we do. But then we also expanded it based on a lot of the expertise of our faculty. Because it's not just wilderness medicine, we kind of brought it as austere medicine, which can incorporate wilderness. It incorporates, we have an international disaster fellowship, so it incorporates disaster medicine, global medicine, event medicine as well. I'm the medical director for the Hartford Marathon, so it includes getting involvement in that as well. And that way we were able to infiltrate and get a lot more resident participation, and then we also expanded it to medical students as well, to really pique their interest and showing that they didn't have to go in just one direction. For the residents, we started early on, we have an intern hike, the first during their orientation, just to get all the interns exposed. We invite several senior residents to come along to help do some teaching as we do it. We do a fairly easy hike so that we don't discourage people that are not really athletic or outdoorsy. And it's in July in Connecticut. It's fairly good weather, so we never have an issue getting people involved. And it also introduces them, but also helps identify me which new interns are interested, and promote them as they move on into their residency. But we do extra things as well. We do have a wilderness day. We're fortunate one of our faculty, her family owns this large farm, and her grandfather built this dance hall in the 30s. It's this huge building which makes great for some indoor events and also outdoor events. There's a lake on the property. It's very large. There's wooded areas. So we have our wilderness day there every year. We do it as part of our didactics. We also hold other courses there as well. We do some medical student courses for disaster preparation. We do a lot of training, not just on the medical parts, especially for global and disaster, but you see in that bottom left corner, we do, one of my things I really love is orienteering. So I teach people how to read a map, how to use a compass. I set little prizes out all around that farm area, and they have to find them. Some of them come back early, and some of them take a long time. We have to go rescue them, trying to find things. But
Knowledge
it's-
application is what we call that. We call that knowledge application.
Knowledge
There it is.
application. But these are tools that they can use that show them that it's not just the medicine that you need to know. There's other survival things we teach about fire building, water sanitation, things like that. And then as I said, we expanded some of our other faculty. We have a faculty who's head of the tactical force for the state. So we have a tactical rescue challenge where they invite SWAT teams from all over the country to do, and our residents help participate in that and help support that as well. We do a lot of training for disaster medicine as well. We have a disaster day, a simulation that we do. It's a huge, I was impressed at the moulage you did here. The moulage we do for this is amazing. We have usually about 30 or 40 participants, volunteers as patients. During it, they all get moulaged, and we have a huge, big disaster presentation as well for the whole residency. And then there's a couple of external things that I've been able to invite people to. One is the Hartford Marathon. We set up a tent. We provide medical care there. Actually, last year we ended up resuscitating a cardiac arrest. Some guy was finishing the half marathon. He collapsed just prior to the finish line. Our team went out there and resuscitated him, and we also helped him finish the race because we brought him across the finish line to get to the ambulance. And he woke up and he was fine. He kept
Really creative DNF, right? Okay.
Yeah, and it was all on tape too because they're filming it. So we were actually at the time the response. It was a great opportunity, a learning opportunity as well. And then another thing that I brought to the residency and also medical students, I'm very involved in the Boy Scouts, now being called Scouting America. And they have these jamborees every 3 or 4 years. And these are huge events. Right now they're being held down in West Virginia every year. Anywhere from 15,000, we've had up to 60,000 scouts coming for a 10-day period. And I'm involved in the medical treatment. We set up a whole medical system there. And it's basically a tent hospital and a bunch of other satellite facilities. And I set up an elective for residents and students to come with me and spend that time down there. So you learn a little bit about event medicine. It's out in the wilderness, a little wilderness, and a little bit of austere medicine as well. So we have all those broad opportunities, and it's really been blossomed. I brought a couple of new attendings on to support me, and I think we have a good, healthy program now.
That's excellent. There are so many different areas for collaboration, and I really want to highlight that. Within wilderness medicine, doesn't just have to be you. Event medicine, EMS, so many other, tactical medicine, all those kinds of things. There are overlaps for these subjects. Bring in other specialists to help you teach some of these content areas.
Hey everyone, I'm Lara Phillips. I'm coming from Thomas Jefferson in Philadelphia. So I actually didn't get interested in wilderness medicine until I randomly took a fourth-year medical student elective and was introduced to this amazing field and basically showed up in all the wrong clothes. I had like a rain jacket and a sweatshirt, and I thought I was like ready for the cold. Thankfully, in my group, I had 3 Eagle Scouts and a flight surgeon, so that was the only reason I didn't die. But I absolutely loved it. So it sounds like most of you are residents, and I loved education. I always knew I wanted to go into that, and so I started small during my residency, and they needed some time in the 4th-year med student clerkship just to fill like 4 hours. And they're like, do you want to do some wilderness medicine? And we had a couple hours of didactics, a couple simulation, and that was what kind of started my interest. So I wound up doing a wilderness medicine fellowship, which really fit for me because I was novice to the field. And I learned so much, got great connections, and had wonderful mentors. And so currently at Jefferson, we hold a biennial Mid-Atlantic Student Wilderness Medicine Conference. And this is fantastic, both for the students to network, and if you're, as a resident or soon-to-be faculty member or faculty member, and they want some sort of advisor, this is an awesome thing to start with because it gets you so many connections to other speakers and, again, focusing on the collaboration. We hold annual ice climbing trips, and currently one of my big goals was I always wanted to run a wilderness medicine elective to help introduce other people who were new in the field of wilderness medicine. And now we run a 4-week wilderness med elective, 2 weeks in Colorado, 2 weeks backpacking in Utah, and we've done it for 7 years. And it's gotten enough attention. We actually had some colleagues reach out to us from Kuwait and asked us to help run a workshop out with them. So we're going in November to do so. So in addition to teaching, that's been really fulfilling. But one thing I always think is important is to continue to grow yourself and your skills, especially since I don't have a prior outdoor career. So I try as much to keep myself updated on humanitarian opportunities, rural health, and of course, anything that affects our local community in Philadelphia, especially with the pandemic. So teaching is one thing, but also continuing to practice, to make yourself a better physician. And this has just been such a wonderful field to do that in.
That's such a great story of how you got involved, right? To say, I loved this and I really wanted to start to progress more and then learn, but then be able to say, we're still always learning. So we can be good at a certain area of wilderness medicine or a certain area of our medical practice, but then how can we grow and learn and continue to perform as you've been doing?
Looks familiar.
Yeah.
Here, I can just talk. Can everybody hear me in the back? I'll try to enunciate, make my grandmother proud. I'm Stuart Harris. I'm coming from Mass General, most recently from Tucson earlier this morning. Oh, thank you. Where we've had wilderness medicine. I graduated in 03 and started the fellowship at 05, and have been kind of marching along since. And only in the last couple of years have we renamed from the Division of Wilderness Medicine to MGH SPEAR. SPEAR just standing for Space, Ecological, Arctic, and Resource Limited, those initials. So we've had the fellowship in wilderness medicine for more than 15 years. And over the last 2.5 years, we've developed a space medicine fellowship that, if you think about wilderness medicine as resource-limited medicine under austere conditions, so those are the two Venn diagrams. So it can be in a wilderness area defined by the U.S. Congress, or it can be after Hurricane Sandy in Manhattan, or in goes to Japan after the earthquake tsunami disaster, or it can be in space. And I was just in Tucson the last couple of days with a bunch of our colleagues in space medicine, and it's the high kinetics, environmental exposures that we're the ones leading on this next step of space medicine. And the American Board of Emergency Medicine's already stepping up, forming its own separate board certification. So these are things, I think if I leave anything, I can't remember what slides I chose on the flight out, but if anything I leave you with, it's just wilderness medicine is a great source for curious people. So much of medical education, of science, is hyperpixelated. You're just down into, the fourth nephron from the left of the, right kidney. Like, who gives a damn? And at some point, one of the great things about emergency medicine is we get to see everybody. There's just the kind of integrated factor of social medicine, of environmental medicine, of acute presentations of long-term disease. We get to see it all. And I think wilderness medicine has that special genius of we're literally outside the box. So the box is where health is an ecological phenomenon. It's a functioning biosphere that gives us health and wealth. And the NSF and the NIH are just like, well, no, this is health and this is science. This is crazy. So it's the functioning biosphere that gives us all health. And we as doctors or PAs or residents, at the last minute, sometimes we get to come and tap people back online. But if we want to truly embrace what we do, it's being aware of that ecological side of things. So we do a lot of climate change work, a lot of policy work, which I wouldn't have thought was anything that would interest me in the least. But your power as clinicians to go in to talk to your local city council, your state reps, your federal reps, people want to hear the stories. And it's still kind of dumbfounds me. Sometimes people I talk to, and positions of real power, they're like, man, this is really helpful to me. It's like, who the hell am I? So, just hold on to that power you have. We've got things kind of going on all over. One thing I wanted to mention, so we've got one thing, the National Outdoor Leadership School, Knowles, we've had a senior medical student course now for 18 years in the Gila Wilderness. It's a 28-day course. Some great outcomes from that. And it's a good introduction that people who have no wilderness experience or that have a lot of it can teach teaching, which again, medicine just fails at miserably. Can teach responsibility, can teach technical skills, and can teach wilderness medical skills. And all of this is directly applicable to the front country. So you don't ever have to go outside again. And what you learn on courses like any of these that have been discussed has direct application to your urban ED experience. One thing we do is do a lot of work with Native Alaskans up in far northwestern Alaska. That's something that people have any interest. I think a lot of people are aware of the Southwest and opportunities there, but that's something that's cool. And then again, space medicine is coming rapidly along and kind of allying that intersection of engineering and medicine and kind of a curiosity that's somewhere outside the walls is what we're about. So always happy to come.
All right, so we have a couple of other incredible experts up here on the panel, and I'm going to just have them kind of go on and talk a little bit about where they're from and what other components that they're doing. All right, just
I've talked quite a lot of these guys. It's interesting to get some done Wake Forest and Winston, North Carolina. I'm our fellowship director for Wilderness Medicine Fellowship, and what really gets me excited about wilderness medicine is the educational opportunity. It's great. There's so many residents here. You are experts in something. You can teach something to someone. And a lot of the wilderness medicine stuff you do is stuff that you aren't going to learn in a classroom. You're not going to learn in ER. You're going to learn by being outside and doing it. Think, hey, how do I make this work? How do I do this? What do I have in my pockets? And how do I deal with the problem I have, right? You take your knowledge that you acquire in your residency training program inside the box, take it outside the box. And that helps you when you're in a limited resource setting, whether it's after a hurricane, where it's, on the field of the soccer field, parking lot of Walmart, or you're in the hospital and you've got people lining the hallways and the corridors we've always had, right? But the opportunities for education are great. We started an educational track for our medical students. And it's like a little specific program they started in any year, first year through the fourth year they can join. They just have little check boxes that they kind of go through. There's lectures mostly delivered by our residents who are on our preserved wilderness medicine electives, or that just have experience or knowledge in something. We start off the medical school with the orientation day. During orientation, we do a wilderness medicine day for them. And for some folks, it's their first time getting a hands-on patient. We do like just simple patient assessment, patient packaging, little simple stuff like that. It's going to be just like the idea of touching people, because you won't do that for the first 2 years when you first do it. PowerPoint, right? So the whole test by PowerPoint when your butt's having an affair with the chair. The first 2 years of med school. And then your first day of being a doctor is like third year med school, and you're like, hi, what do I do, right? And so, I mean, fortunately, most of us, a lot of people have previous experience, other life experience, allows you to talk to people, and putting up on people, but in a nice way. But wilderness medicine is great. You just want to make sure that you can keep your passion about it and share that passion with others, and one of the best things is through education. And for residents, it's a great way to work yourself into a fellowship. It's a great way to work yourself into a faculty position. For medical students, it's a great way to get into a residency program. And for faculty, it's a great way to get promoted. I got promoted all the way to full professor with wilderness medicine activities and education. We do an annual conference and all those things that everybody else does too. We actually started the first student conference for wilderness medicine 17 years ago. So we started our 17th annual one this year. So if anybody's interested in being a faculty at a regional conference, please let me know. I'm happy to get you guys a spot. All right, thanks, guys.
Excellent. I think that's a huge point to make as well. You are going to be an expert at something within the topic of wilderness medicine. And then finding someone else that can help you either grow or learn or develop that specific expertise is a huge component that will help you grow and build your own department. And I can attest to that. It is an absolute strategy to progress from within your own academic career. I tricked my job now into hiring me because they didn't have anyone that said, I do wilderness and environmental medicine, and I looked at all the faculty pages. So in my cover letter, I said, hey, I do that, and you guys should have that. And then I've been sort of fumbling my way through it since then. Katja, let's have you go next just because you have the microphone.
Yeah. I guess I set myself up for that by holding it.
You sure did, yes.
So, yeah, right. I already avoided sitting on the seat that had it on it, but I can only avoid it for so long. So I'm Katja Goldflame. I'm the Associate Program Director at Yale, and I actually took the course, when was that? A long time ago now. 2 years ago, right? With the Knowles program. Basically, I was the resident that went on the course, and I thought I didn't really know that much, but it was a bunch of medical students, and so you know a little bit more than the medical students. So that's the glory of the hierarchy of the medical system, is unless you're a medical student, you actually know a little bit more than the person coming after you. So may as well use that opportunity, right? And I think that's something that's kind of been echoed a few times, which is really just using the resources that you have available. And obviously, as an educator myself, I think the teaching component to me is really, really kind of one of the more near and dear to my heart. And what we do at Yale is a number of different opportunities. So we have actually also a university, and Yale University, I don't know that. It's, so we have undergrads, which is beneficial, and they actually also really like to do wilderness stuff. So for them, it's more stuff than medicine, but what we do is we actually have our residents teach the medical students prior to their orientation course, which is really helpful because it's people that really are even impressed that you can check your pulse and your foot. So the bar is relatively low, so any one of our residents, and I don't mean that in a bad way, like it's I think in terms of building confidence as a teacher and as a resident, I think it's actually a fabulous opportunity in that regard. So I think the residents really enjoy it. It's a 2-day course that we do, and we do it in place of conference so that they get conference credit, which I know you all love, and then you get teaching credit as well. And since we have a couple of teaching components to our curriculum, that's sort of a double dip in that regard. But again, I think it's sort of looking around and seeing what all the resources are that you have around you, both in terms of human capital as well as people that want to teach, people that want to learn. And then, for example, so we're in Connecticut, we have the Lyme, Connecticut Center of Excellence on clinical, I don't actually know exactly what it's called, but I'm sure it's something on clinical excellence on ticks. So we can actually send ticks in a little envelope by mail and have them be evaluated. So that's like our latest wilderness thing that the residents have gotten really into. And one of our...
Ticks flying through the Postal Service? Okay, good.
I don't know if the Postal Service is aware, but that's okay.
Right, don't tell anyone.
But nonetheless, it's one of our areas of concentration actually did a field trip to that location. And so just looking around, there's a ton of really amazing opportunities I think that you can use. And just like I said, and multiple people have said, I think dipping into the tox faculty, for example, are great. We've done wilderness hikes where they've come and shown us of various poisonous plants that you don't want to eat. And so again, dipping into what resources you have available, I think is sort of one of the key components, and using all the different really, like I said, the hierarchy, I guess, of medicine. And if you have an undergrad campus, there's a lot of opportunity that if you just look for it, you can really kind of use, from what a lot of people have said here, different things that may be applicable to your setting. I know we're all from different environments, so you may not have an undergrad university, but you have a medical school, or you have some paramedics, or you have a tick center. So there's all kinds of stuff that you can do, and I think that's really one of the things about wilderness medicine is it's so applicable to so many different opportunities. And hopefully that's kind of what you take away from the panel, I guess. So.
Yeah, absolutely. Taylor, do you want to go?
Thank you. Hi, everyone. My name is Taylor Haston. I am in Georgia, similarly hot to Arizona.
No.
I know I said it was more humid here than I thought it was going to be compared to Georgia. So anyway, I run the wilderness medicine program at the Medical College of Georgia. If you look for us, we probably changed our names a lot of times. So we're now WellStar MCG Health, but we still are affiliated with the medical school. So MCG, Medical College of Georgia, stays the same. Yeah, just to kind of echo what everyone else is saying. So we have a fellowship program there that this year, for example, it's really just about figuring out how to make something work. So wilderness medicine, austere, environmental medicine, we experience it in the emergency department. I don't know how many times at a level 1 trauma center. I mean, the hospital's great. No hate, no shade to my hospital. But as it is, in the ER, oftentimes we are forgotten with supplies and whatever else we may need, right? So I mean, sometimes it's a barren desert in the ER, and you're having to improvise and figure out how to do something or make something work. You can't get in touch with the consultant. You know, whatever the case may be, you're improvising and pivoting left and right. So I always say wilderness medicine is like pivoting. If you can pivot and figure it out, then that's it. I also think that, you know, like selling it to your program or where you want to get a job. This year we have 2 fellows. One is pediatric emergency medicine. And so she just yesterday ran an entire pediatric wilderness day for their residency program. And they weren't allowed to go outside apparently. Because it's dangerous.
That's fantastic.
But she made it work. And yeah, so one of my prior fellows, the same way, kind of weaseling your way into an academic job. She worked in the community for a while, and now she's at Vanderbilt. They bought out some new, smaller hospitals a couple years ago. So it was essentially like affiliated with Vanderbilt, but nothing on main campus. And she's wilderness medicine trained, so she, you know, basically negotiated and got a spot where she's doing some shifts, you know, on campus, some shifts at the main shop, some at the smaller hospitals. And she actually currently this week and next week is running a 2-week med student elective that she got approved. And they don't have a wilderness medicine program there. So, you know, it was not easy. There was a lot of risk management and questions and, you know, some things that sound a little absurd. But again, people that aren't familiar with what it is, it's a little scary, right? What do you mean? You're going to go outside and rub dirt on your face? Like, that's what all my colleagues say that I do. They're like, what do? You just go outside and, you know, throw dirt in the air? Like, yes, that's what we do. So, yeah, I encourage you to be creative. You know, as Stuart said, curious is a curious profession. You can figure out how to make it work and incorporate it into anything that you're doing, whatever it is that you're doing. So I think that there's always a way. And you can sell it. I mean, wellness. I mean, during COVID, you know, how many people were going outside, and it's just an opportunity to connect with people, make relationships, learn how to educate in different ways. And yeah, and we're doing all the same stuff in the community, residency program, the med school, pre-hospital, event medicine. You know, we work the Masters Golf Tournament. We staff medical support there. And yeah, that's actually very wilderness, you know. You're like, oh, that's not the wilderness. Yes, it is. Absolutely. You can't have your cell phone, exactly. So, yeah. So anyway, if y'all have any questions, but yeah, thank you.
Excellent. Hillary, do you want to go?
Hi, I'm Hillary Irons. I'm at UMass. And,
No,
okay.
we're playing hot microphone.
Oh, okay. Everyone has already brought up so many of the different things that we do here. I have student electives and have done some resident things as well. Thing that I think that we haven't talked about that I do a lot of is something called MedWar, is Medical Wilderness Adventure Race. And this started, I was a student at MCG, and it started by 2 of our other people that have been up here before on this panel, and I came in the second year and have been involved with it ever since. And one of the ways to get people involved at your institution, if there's not a wilderness anything there, is to try to drum up interest. And so by starting one of these events, you can kind of get a lot of people interested in it. And you're bringing the idea to people who might not have even thought of wilderness medicine at all and just wanted to go on, have this event and have fun outside. And so what it is, for those of you who don't know, is an adventure race in a group of either 3 or 4. And it can be students, it can be residents, it can be EMS, it can be anybody who's interested. And they get a map and a compass, and they navigate, orienteering, to a site on their map. And when they get there, they might find a wilderness medicine scenario, so it brings in stimulation, which could be a disaster, it could be just somebody who sprained their ankle, it could be they don't know what they're getting when they get there. Or they could also have some sort of a task they have to do, a skill, or just some questions that are out there that they find. And it becomes a competition, and you work together and you accomplish it. Maybe you splint the ankle and you carry them off to the next place. You had to complete all of these things within a short amount of time. So that's one thing that I have been involved in, and Jeff has too, and Taylor, and there have been a number of these throughout, and they're all over the country. Oh, there we go. This is one of the most recent one, which was just last weekend. No, yeah, last weekend, 2 weekends ago.
Yeah.
We're coming back after COVID. We kind of had fewer events during that time, although yours managed to stay open the whole time. At any rate, we have also, a number of us have alluded to resident days and wilderness days within residency. I think there's a lot of residents here. And so one thing that we have done is kind of taken this, distilled it down, gotten rid of like some of the biking and the canoeing and some of that, but kept all the medicine and turned it into a didactic day. And so some of us have built those, and through MedWar, which is a nonprofit that it was made by, again, other people, those of us who are doing this, we are actually creating these, because it's kind of daunting to put one of these together on your own, where we have the scenarios and the questions, and you can take this and bring it to your residency or your medical school and put one of these on in your 3 or 4 hour didactic time. And I've been trying it out on our residents, so I see a couple of our residents in the back there. And they seem to like it so far, and they've can ask for it to continue. And so that's one of the ways to get interest and to really get people involved. I get our toxicology department, our toxicology division out there to talk about snakes, and I get the disaster people out there. I've even got the wilderness or the ultrasound people out there with their butterflies. So bringing them all out to get involved.
So I hope that what we've really illustrated is we have people that are from all over the country that, even though we all say that we practice wilderness medicine and we teach wilderness medicine, we do it in a lot of different ways. There are so many different areas, so many different strategies, everything from direct experiential-based teaching all the way to formal organized fellowships, med student lectures, interest groups within the residency, track systems like we have, and I think a lot of you guys have as well. And the last thing that I want to bring up before we unfortunately are going to have to break is the importance of collaboration and knowing who can help within wilderness medicine. I know myself, I'm not going to speak for anyone else, I think every single person up here has helped me in some way in my own personal development, or if I just have a question about what to teach. A couple of years ago, I was writing an article on frostbite, and I just emailed people and said, who has a picture of a frostbite finger that I can use for this article? And I got inundated, absolutely inundated with images and people just saying, hey, yeah, absolutely, use this. The same thing happens with lectures. The same thing happens with educational opportunities and experiences. The last thing that I want to bring up is don't go at this alone. If you have this interest and if you want to start to bring some of this to your residency or work on trying to improve it, reach out to any one of us or anyone in wilderness medicine. We are able to do this because of people that have helped us, and part of what I really enjoy doing is trying to reach up as well as reaching down to help those that are interested in practicing and working and figuring out how we can do this together. So rather than, we have 3 minutes left. So rather than saying, hey, if you guys have any questions, what I'd like to do, I'm going to put my, or do you have something? Yes.
I wanted to say, as part of that outreach, we're coming full circle, and then I think it's 2011, a lot of people on the stage here first created the SAEM Wilderness Medicine Interest Group. So it's a great access point, resource point. We're moving rapidly towards academy status. So one, to recognize this community for, 13 years of exquisite work, and as a point of access, that's something that, I can't remember when we're meeting, I think tomorrow.
Tomorrow afternoon? What time? It's in the guide. So if you have interest in getting more involved and meeting people on a little bit more of a granular basis, please come and join us and ask more questions. So we will wrap it up. What I'd love to do, if the panel is able to, can we just hang out for a second? If anybody has specific questions about the specific area that they work on, or any more tailored questions towards anyone else, please come on up and we can have a bit of a discussion. Thank you guys so much. I appreciate it. Thank you so much to our incredible panel. We appreciate your time. Thank you.